One of the things that's very commonly taught using electrical impulse adjusting tools is what's called mirror image adjusting. Now, no matter what technique you do, no matter what health profession license you have, everybody agrees there's one ideal posture, and they're referring to optimum posture in a neutral position. So when we look and evaluate people, it's pretty easy to see distortion patterns. We see head tilts, rounded shoulders, we see any variety of different postural distortions. You'll hear people discuss how you live, function, and exist in gravity has a tremendous impact on your overall health and well-being. And it does. It makes sense as we're trying to model people into this ideal posture as if we treat them in an ideal posture, how their nervous system upregulates and we're able to move forward with that. So if we're looking here at an instance, let's just say that she normally would have a very high shoulder in one way and a head tilt compensating in a rotation. So even it might seem uncomfortable to her, but we would put her in what we would consider that leveled position. And let's just say again, she's got kind of a head rotation, and we're going to balance her out to what we would consider ideal. Shoulders back a little bit. There you go. Now, this may feel uncomfortable to the patient, but how we are creating these patterns, and you can still motion palpate, find areas of fixation or need, apply your x-ray analysis to this. Everything would lead you still to identify why you would be treating a person in this realm, as well as, again, motion palpation is very common for a lot of people. And just very simply, we are going to just adjust in what we would call this mirror image posture. And ultimately, you're just making some light taps on the body, but when you really do focus in on it, you can feel that vertebrae. You can even hear the machine change a tone when that vertebrae starts getting intersegmental motion there. It may be subtle at first to you, but with a very, very short amount of time, you can even feel release within the vertebrae, as well as, again, a lot of times you'll start hearing a change in the tone of the machine as you start getting motion into that segment. Now, a variety of heads can help you. Like I said, a lateral atlas can relate a lot in order to a head tilt that people will do. So again, as we're looking at some of those finite sections, we're going to change within our head with the unit that we're using. And very gently, you can just come in, put that person in that ideal positioning. It's coming in on that optimum line of drive with that atlas correction. And just very gently putting that tapping sequence in there. Now, you can develop a comfort zone as far as the speed that you use. There's no wrong way to use it. Most practitioners are just going to leave it at that upper level because you have so much control on the velocity that you're providing into it based upon tension, preloading it. So even that just quick, nice little hit, some people might feel just a little bit more comfortable here if you're looking for that real specific single tap. Again, it's going to be based upon your philosophy, how you see those changes occurring, and what's going to be the most comfortable for you.